Hello, Be Health Empowered family. Welcome back to another week of Excuse Me, Doctor. I'm your host, Dr. Melissa Clarke. I am so delighted that you're joining us tonight. And of course, you could call me Dr. Mel. I am here to answer your questions. And we are here every Monday night, 9 p.m. Eastern, 6 p.m. Pacific. We are here specifically to give you information when it comes to making decisions about your own health and being empowered to do so by having information that's based on science and facts. We bring focus to speculation, we clear up misinformation, and we definitely debunk disinformation. I want to especially welcome the first time folks who are joining us tonight, all my newbies. If you haven't done so already, please do me the favor of hitting subscribe if you're watching on YouTube and hitting like if you're watching on Facebook. Thanks so much for doing that. And tonight, this is a special recap episode. The summer is here. We're out and about. Our kids are going to be going back to school soon. People are taking long-awaited vacations. And I'm going to say, I did that. That's why I wasn't one of the reasons I wasn't with you all last week. Offices and businesses are reopening. So our co-producer, Lila Mays, isn't with us tonight because she had to be in the office today, first time back. And so we wanted to hit the highlights from recent shows for you and answer the questions we didn't get to and address any new ones that you might have tonight, given that all these changes are happening in our lives. And we're not just going to cover COVID. We're going to also touch on our mental health episode that we have, losing the COVID-15, that weight loss episode that so many people liked, and so much more. So share, because we are going to be covering a ton of stuff tonight. So get all your friends watching, those people who have health questions and who didn't get them answered maybe on prior episodes. Those of you who may still have lingering questions about the COVID vaccine. We're going to be hitting all of that. So this is another Excuse Me, Doctor episode that is not to be missed. And I am so happy to have with me tonight my co-producer, Mr. Wayne Bruce. And as I mentioned, those Lila fans out there, she's not joining us tonight, but she will be back very soon.
Y'all don't cry. She'll be back. I'm lonely.
She'll be back.
I'm never too lonely with Dr. Mel, but I'm lonely. Hey, yeah, missing Lila.
Hey.
We're missing Lila. We're missing Lila. Hey, Valerie. Hey, Valerie. We're missing Lila, but we'll have her back next week with a brand new show. How about that?
Right. Absolutely. And we have all of you, which is why we're here. So please remember to start writing your questions down in the chat. And we are going to hit our weekly recap that we always start off with. Right, Wayne?
Yeah, we're going to start with the weekly recap like this. Here we go. And of course, we always start with Dr. Mel and the numbers for this week.
Yeah. So as of today, we have 34,726,000 cases of COVID-19.
Wow.
And you know what? Unfortunately, we are ticking up in numbers, y'all. We are now back up to 20,000 new cases a day across the country. That's a 50% increase from 2 weeks ago. That's a lot. And, some places like Alabama, Mississippi, Nevada, Wyoming, rural Arkansas, rural Missouri are especially hard hit because there are pockets in those places of really low vaccination rates. Like we're talking less than 30%. So Greene County, Missouri, one of those low vax places, has the highly contagious Delta variant running wild in the population. In just 6 short weeks' time, they had 10 patients 6 weeks ago. It's now over 130 patients in that county. And that's more than the third wave of COVID that hit this past December and January for that county. So it's serious out there.
So what's the vax facts? That leads us to the vax facts, but that also leads us to some unfortunate numbers.
Yeah, well, before we get to the vax facts, we're at 622,825 deaths from COVID. And fortunately, overall in the country, the death rate is trending down. That's great. But as you know, if you've been watching this show, that the death rate always lags 3 to 4 weeks behind the case rate. And so, since we're seeing the cases go up, we're unfortunately anticipating that the death rate is going to start going up again very soon in the next couple of weeks. And we know that unvaccinated people are the people who are now dying of COVID. They account for more than 99% of deaths from COVID-19, those people that are unvaccinated.
Wow. I'm sorry to hear that.
Yeah.
So I guess we've got our vax facts, right? We,
Well, yeah, we do have our vax facts. So there are 158 million people who have been vaccinated with COVID. So, I mean, with the COVID vaccine. That accounts for about 49% of the population in the United States. So those people who've been waiting to see what would happen, you now have 158 million people you can talk to see how they're doing.
right.
Um, yeah, so there are 20 states, including the plus the District of Columbia, that actually met President Biden's goal of 70% or more of adults getting at least one dose of COVID. So that's great.
Mhm.
And I specifically want to shout out Puerto Rico because a few weeks ago they were way down at the bottom. Now they're like up in the top 10 as far as states and areas that are vaccinated. Now,
Mhm.
unfortunately, most of our southern states like Mississippi, Arkansas, Wyoming, well, Wyoming not southern, but one of those that are lagging in the bottom 15 of states.
So as Lila would say, the MISSISS
Yeah, they're missing in action when it comes to
missing in
vaccination.
action when
Yeah,
it's home.
unfortunately. And,
So
well, I was just gonna say the thing about those southern states, the southern states are where there are large concentrations of African Americans, and we know that we as African Americans, unfortunately, are the ethnic group specifically, that is at the lowest tier of vaccination rates, something like around 30 to 35%, of those states that are reporting race and ethnicity are reporting those low numbers of vaccinations among African Americans. And the other group, of course, is white Trump supporters. So who knew that
wow.
we would have that much in common?
Wow. That's that is unfortunate. So
It
look,
is.
everybody's talking about the Delta variant, and that's not cool, but we've heard a lot about the Delta variant. But this week we start hearing about the Lambda variant. So
Yeah.
tell us a little bit about that.
Certainly. Well, that's a great question, Maine. So this is the deal. So y'all might have noticed they were talking about countries, the UK variant, the India variant, the Brazilian variant.
Hmm.
Now they've shifted to Greek letter alphabet so as to not associate a particular country with a variant, because the fact of the matter is variants can pop up anywhere, and
Right.
variants that are more infectious and more deadly could pop up in any body. And so
Mhm.
now they've gone to this Greek letter naming system. And so the Lambda variant is one that has devastated Peru, but is now here and showing up in the United States. And there's been a higher death toll in Peru. And it's thought that it's due to this Lambda variant, but it's unclear, is it because the Lambda variant is more deadly?
Mhm.
Or is it because, for example, certain areas of Peru may have lower access to healthcare, and not the availability of sort of cutting edge medicine to be able to care for the individuals who take sick with this Lambda variant. So we don't know if it's more deadly, but it's here now. And so we're going to be seeing alongside what's happening with the Delta variant if it's more infectious and if it is more deadly. Time will tell.
Whoa, that's as long as they don't get down to the Kappa variant and the the Omega variant, we're gonna run out of Greek letters. You run
Yeah,
out of Greek letters after
unfortunately.
Omega. So I'm just saying, not to get involved in that, but I just hope we can
But
get
if
a
we get
hold of
vaccinated,
if we
yeah,
get
if we get
vaccinated, right?
vaccinated, the sooner we get vaccinated, the less variants will pop up. It's just that simple.
Okay. All right. So look, we look at Pfizer. Pfizer and the U.S. government are sending different messages. I think Pfizer on this booster area. You want to talk about that?
Yeah, and it's kind of a shame that this is happening because this has been part of the issue with the pandemic, different people saying different things and
Hmm.
confusing the public in general. But the bottom line is that Pfizer is saying that they've seen some waning in immunity after about 6 months, and they're basing this upon data from Israel and the Israeli Ministry of Health, and also some of their own internal data. But the CDC, FDA, and NIH are all saying that Pfizer is being premature with this out the gate, that they don't have clear evidence that's showing waning immunity. And we're still seeing that fully vaccinated people don't need a booster. So, based on the actual numbers of breakthrough infections in this country, there have been about 4,000 breakthrough infections. However, that's out of 158 million people. I mean, so that's like 0.00004 or something like that. So, that breakthrough infection rate in terms of keeping people out of the hospital, keeping people alive, the vaccines are still extremely effective. And so, what we are going to need to see is over the next few weeks to months, what's happening with the earliest people who got vaccinated. So, those would
Right.
be people in nursing homes, etc., and elderly people, and see, is the Delta variant affecting them? So far, so good. Everything's looking fine.
Cool, fantastic. That brings us, even though we're in July, and it's hard to even think we're in July, like
We're in
it,
mid-July.
we're mid July. Where did it all go? Uh, where did it all go? You know what I'm saying? Like, where
Yeah.
did the year go? So, the CDC, I'm like, the CDC is already talking about fully opening schools. What's your
Yeah.
thoughts? Mhm.
Well, for the mental health of our children, I
Mhm.
think it's really important that people that kids get back to school, and the mental health of their parents too, and their ability to go back to work. So all those things have to be weighed into the equation. And so that's one of the reasons that they're urging schools to reopen, but it's with an important caveat. You gotta look at what's going on in that particular community. What's the vaccination rate in the community? What's the spread of COVID? If COVID is on the upswing and there are not a lot of people vaccinated, you have to maintain physical distancing, wearing masks,
Mhm.
watching the ventilation. Do the windows work? Is the right ventilation system installed in the building that's
Mhm.
recommended by the HVAC Associations of America?
Yep.
They're very specific criteria for reopening schools. Um, they also recommend that unvaccinated children, teachers, and staff not only wear masks, but be tested once weekly where community transmission is high. Um, Also, kids that want to have extracurricular activities might need to be tested up to twice a week. And
Mhm.
of course, if you're feeling sick, whether you're student, staff, or teacher, you need to stay home. So all these things all have to happen in the context of what is happening in the community, and we especially have to be vigilant about our African American and other children of color because we know they have been historically at higher risk for getting sick and dying from COVID.
Wow. Wow, that's incredible. So look, it seems like everything has side effects. And a lot of people were pointing out these side effects that's coming from vaccine and COVID. Just everything. Now walking has a side effect. I'm
Yeah,
blown.
well, walking does have a side effect, but it's a good side effect. So this
Oh.
is the thing. There was a study in the UK of, like, hundreds of thousands of people, and it showed that poor exercise
Hmm.
coupled with poor sleep, so not getting enough exercise plus poor sleep is really bad for you. It severely increases early death, the risk of heart disease, and cancer compared to people that exercise regularly and sleep well.
Hmm.
But the side effect of walking is that if you do brisk walking for just 2.5 hours a week, not a day, a week, it appears to cut out most of the poor effects on your body of losing sleep. So it's like a counterbalance. So
Okay.
the bottom line is walking can erase the effects of poor sleep on our bodies.
That's a good thing.
That's a
So
great thing.
so I might take a walking vaccine. But as soon as you say vaccine, people freak out. So anyway, look, we go to number 6 in our recap. And we have to come back to the middle of the country. We love middle America, right? We love middle
Yeah,
America.
we do, yeah.
Sometimes.
Yeah.
And this is one of those times where we have to say, okay, what's going
What's
on with
going
middle
on?
what's going on? Talk
Right.
about Ohio, Doc.
Yeah, well, at the beginning of the month, Ohio's governor signed a bill that allows medical practitioners, healthcare institutions like hospitals, and even insurance companies to not provide or pay for healthcare services based on conscience. Okay. So that means that based on what they perceive to be morally right, they can deny care to individuals. Now, it doesn't apply to emergency care, but of course, this raises all kinds of red flags. And the LGBTQ community, along with other local health officials in Ohio, are calling foul and raising concerns that this new law is going to have a negative impact on certain groups being able to access care. And I think it's a slippery slope because, somebody's quote unquote conscience can include denying services based upon sexual orientation, based on gender, based on race, even. Let's
Mm-hmm.
say they think Black Lives Matter is immoral and somebody has a Black Lives Matter t-shirt on. Allegedly, they could deny care based on that. Religious differences, so Muslims or Jews or Catholics who they may have an issue with, they may decide to not care for. And that's absolutely outrageous. It undercuts us as providers being non judgmental, which we are called to be in seeing and treating everyone as a human being deserving of the highest quality medical care. And yeah,
So
it's not a good thing.
is that in the Hippocratic oath, or is that just in our oath as Americans, or
It's it's in
it's
our oath as human beings. I mean, and
exactly?
I feel so passionately about this that I decided to make this the subject of next week's show. So we're going to be talking to LGBTQ activists who are concerned about this particular issue and issues that help that cause there to be barriers in care for that community. And so, you know, stay tuned. We're going to cover that next week much more in depth.
Whew. I mean, that just took it out of me. I mean,
Yeah.
we're at the end of that segment, and all you people who want to comment on the vaccine and all that stuff, if you got something crazy to say, move on to the next show. Can I say that? These views are not the views of Dr. Clarke or Dr. Melissa, but they're the views of the producer.
And
Okay.
I am happy to engage respectfully with
We,
anybody when it comes
respectfully.
to the
That's the whole thing. We're
respectfully
not
with
gonna call
anybody
people.
when it comes
We're not gonna
to
call people names. We ain't
COVID-19
gonna call
vaccine.
none of that. All right.
No, I
So
never do that.
you know what's next?
What?
The weekly debunk. Stopping misinformation in its tracks.
This one comes from my man Tyrone Twitter Fingers. He said, "Hey, I heard if you get vaccinated, you cannot donate blood because it changes your DNA." And when I
Wow.
saw that, I said, "I don't know about that." Excuse me, Dr. Mel, is that true?
Unfortunately, or fortunately, actually, that is absolutely not true, Tyrone. If you receive a vaccine, whether it's a COVID vaccine or any vaccine, you can still donate blood, you can donate platelets, and you can donate plasma, which is often needed for antibody treatment
Right.
against COVID-19. So, it's impossible to change the DNA of a vaccinated person. The vaccines do not affect your DNA. And furthermore, if you've been vaccinated and you donate blood to somebody, that doesn't change their DNA either. And the reason is there's three reasons basically. Number one, when the vaccine is given to you, and the genetic material that's contained in the vaccine enters your body, it only survives for minutes to hours. So it doesn't even have a chance or time to quote unquote change your DNA. And then once it gets into the cell, which is its destination, and the goal is to give the instructions to your cell on how to make a component of the virus, right, the spike protein, it cannot enter the section of your cell where your DNA is. It's walled off. And God, if evolution, whatever you believe in, made it like that so that our DNA could not be messed with by something that invades our body or gets into our body from the outside. And then finally, we have been, ever since infancy, exposed to the genetic material of viruses. Anytime we get a cold or a stomach flu, whatever it is, we are exposed to the genetic material of viruses. And so they don't change our DNA, and they won't change it whether it's introduced via vaccine or whether we are exposed to it naturally by somebody sneezing or coughing or singing on us. So there's just no merit to that. Now, to be eligible to donate blood, because it's always, blood is always needed, it's best if you know the name of the vaccine that you were vaccinated with. There's just to inform them so that they know that you were vaccinated. And it's important to know you don't have to put off donating blood if you've been vaccinated. There doesn't have to be a wait period. And then finally, you can donate. It's best if you have any kind of symptoms, of course, of COVID, to not donate. That would be the time to hold off and go get checked out and get a COVID test. But otherwise, if you're feeling great, go ahead and donate. That's my spoken word for tonight.
If you feel great, go donate. You sound like Johnny
Right.
Cochran up here. So we're moving back. We're on to the next scene. And look, I just saw something in the comments. And it's a Lila Mays sighting. So y'all show Lila Mays some love in the comments. Show Lila Mays, she couldn't get on tonight, but show her that love in the comments, all right? Y'all show Lila the love in the comments, all right? So, Dr. Mel, this is a producer show, and I want to say Lila was involved in the making of this show, even though no animals were hurt, but Lila was involved in the making of the show. And we chose some of the highlights over the past couple months that we've been dealing with here at Excuse Me Doctor. And we chose some incredible clips we have for you. And they're not just about the vaccine and all that stuff. And they're just not about COVID and, all the people. And we're going to get to your questions. So all those people who have legitimate questions, we will get to your questions in
a few.
I'm going to put up some, people are showing love to Lila. We're going to get back. I see we got another returning star from the Mays family that's going to be up. But I want to first start with kind of what the vaccine and COVID has done in our community. And I want to start with teenagers first. We want to start with teens. And we had an incredible teen on, a young lady from Ohio, Elena from Ohio. And she talks about the stress of COVID and going to school and everything. All right, here we go.
Very stressful to have to be vigilant all the time. Did you find it to be something that was causing you anxiety or concern?
I did at one point, especially the beginning of the year where I was doing hybrid. But once we got to the middle of the year, I had decided, since it was flu season and some of the COVID symptoms are like the flu symptoms, I just didn't really want to mix myself into that. So I decided to go fully online, and we're given the choice to do so. And when I did, I noticed that I did feel a lot less stress on having to protect my family and my parents and also me. Yet the social aspect that I was lacking online really did pay a toll to me mentally. So after that point where I was online, once I got back into the groove of things and went into school, I learned that my mental status was probably a lot better. And my anxiety about that was dying off, since right then we were just introduced into the vaccine and how people that were higher risk were able to get them. So once that came out, I definitely did have a little relief and felt that I could be social and without the fear of bringing the COVID back to my parents.
Yeah, no, that makes total sense. And so your parents got vaccinated. Since that pressure, in a sense, was off, what led to you deciding to get vaccinated? And I guess I'm letting the cat out of the bag because you have had your first dose, right?
Yes, I have.
Yeah.
Honestly, I felt like I could contribute and to helping stop this virus that has taken a toll on everybody in one way or another. I felt that was my way that I could contribute, since I'm not a doctor or a nurse or anything like that. But I felt that was a way that I could get involved and help out by making not only myself, but the ones around me a little bit safer.
Wow.
Wow, what a testimonial. I mean, and she's only 14. I mean, at the time, I think she's had a birthday since then, but wow.
Wow. I mean, hey, Elena in Ohio, hopefully she did great in school. I'm quite sure she did great. I mean,
Yeah. But
it's incredible.
What she was saying about, doing her part, it's like the analogy that I use, that when you get vaccinated, it's like you're linking arms with others to form a human chain to protect the people behind us. And the people behind us that need protecting are the elderly, the very elderly and frail people who we don't know how well the vaccine, how long that immunity is going to last, or whether they got enough immunity. It also is for people with cancer, again, or people who are on medications who may have gotten vaccinated, but we don't know how effective it was in them. And then those people who are unvaccinated, our children under 12 who don't yet have a vaccine, and so that they're eligible to take. And so it forms like this protection, this human chain. And if you're not vaccinated, you're the weak link, because therefore you see what's happening in the communities around the country where the vaccination rates are low. And you're seeing that when more people get vaccinated, there are fewer cases of COVID.
Yep.
It's simple.
And we have a couple comments. Barbara Johnson in comments, I want to bring her up. She said, I lost my brother last Thursday to COVID. Thing good to watch them die. He could not breathe. And our hearts go out and our prayers go out to you, Barbara. I am
Absolutely.
definitely sorry. I am definitely sorry to hear of your loss. Moving from Elena, we had Michael Eric Dyson's show with Michael Eric Dyson. It was called Blacksinated. Blacksinated.
Yeah. I mean, he is so dynamic.
He is dynamic. And he came up with that. And he had a message to the 18 to 40-year-old crowd. So let's go to that clip.
We have got to tell the 18 to 40 years old, you are not invincible. And you think you can't get this? You are getting it. And you are dying from this disease. And you are being besieged by this virus. This virus is no respecter of persons. People who are 8 to 80, people who are young, people who are physically fit, people who are doing well have gotten this disease and died. So please don't think that you are invulnerable, that you are invincible, that you somehow can shake this disease off and you'll be fine.
Wow. No
Powerful.
chill words.
Yeah, and I thought at the time, when we did that interview, the Delta variant was not really as prominent as it is now. And now we're especially seeing younger people getting sicker, getting hospitalized, and even dying from COVID because of this more infectious strain. There was one statistic from an ICU in Missouri. I think I mentioned that Missouri is particularly hard hit. 91% of the people there in the ICU are on ventilators, are on life support due to COVID. A few weeks ago, it was only 50%.
Wow.
And they're in their 20s, 30s, and 40s.
Wow.
Let that sink in. Very
That's
different picture than it was 6 months or 9 months ago.
that's incredible. Before we get to let me get to one question before we move on, because I want to get to this question. And it's from
Mhm.
Ellen Claire Lamb. And she says, I'm going to a conference at the end of August in New Orleans. So we'll be staying indoors for most of it.
Right.
I had the J&J vaccine. Should I get a booster before I go to New Orleans? Should she get a booster?
Yeah, that's a great question, Ellen, and thank you. Good to see you and hear from you again. Um, so, you know, the J&J vaccine recently came out and said that it does provide enough protection against the Delta variant. There was a lot of discussion among public health officials last week as to whether people who got the J&J vaccine need to get a booster. And as far as we can see to date, the 11 million or so people who received the Johnson & Johnson vaccine are doing just fine against the Delta variant. So no need at this point to get a booster.
Okay. All right. So that brings us to we had an incredible guest, Dr. Theodore Watkins, who has a show on Pacifica on the Pacifica channel here, WPFW, and he's a natural medicine physician, basically, right?
That's
And
right. Yeah.
and
Well,
Lila
actually,
and I,
he's a MD. He's a MD who is an integrative medicine physician, which means that he uses primarily natural approaches to healing.
okay, cool. Lila and I thought that this would be an incredible clip for you. Here we go.
I want to hear from you why you think that it's important for people to get the COVID vaccine, even if they ascribe to holistic principles and live a holistic lifestyle.
Well, the simple answer is that the virus kills. The vaccine does not. That's the simple answer. I doubt that anyone watching us tonight doesn't have a family member or someone very close to them that have died as a result of COVID. All right, and this virus is different, I believe, than anything else we've seen. Because it just doesn't act like a normal virus. It doesn't want to behave. You were talking about the variant earlier.
Yeah.
A couple of weeks ago, I interviewed a good friend of mine, pediatrician, and we were talking about you talked about the severity of the disease in children. Well, they often compare the COVID virus to the flu virus.
Mm-hmm.
The flu virus kills what? Old and young. All right.
Yeah.
Well, the corona kills the old, but has not killed the young until until the variant started. And one of the interesting thing is that even I thought for a long time that the children were not getting infected, but I learned that the children were actually getting infected but not getting sick. But now they're getting sick. They're going to the hospital, and many more of them are dying. Why is this variant affecting these children the way that it's affecting? We really don't know. We really don't know. So what we have to do is we have to do everything we can to protect ourselves and to protect our families. And diet is very important. Some supplementation is very important. But in addition to that, I believe we need to do everything we can. If the left one won't get you, the right one will. We need to understand that. And we need to make sure that we cover ourselves with every tool possible.
Yeah.
He's speaking the truth. I mean, I think of it as like layering. When you're going out into the cold, you don't just rely on your skin to protect you, even if your skin is healthy. You put on, if you're going into sub-zero degree weather, you put on several different layers. So think of it as that. If you have a holistic lifestyle, that's great. If you take supplements, even better. If you're getting enough sleep and hydration, wonderful. If you're eating a great diet, perfect. But then the vaccine adds that additional layer that really protects you. It's like that bubble coat that you put on that just seals in all the heat, right?
Right.
And so the vaccine works in conjunction with all the other wonderful things that you're doing. The other analogy I use is like, you're taking a pop quiz. You don't know it's coming, which would be the equivalent of the coronavirus infection. And the night before, somebody comes and gives you all the answers to the test. It doesn't matter how smart you are. If you have all the answers to the test, you're going to pass it the next day. That's what the vaccine does. It informs your immune system exactly what to do and what the virus looks like without making you sick, so that when you do get exposed to the virus, i.e. the pop quiz, you are fully ready. Your troops are already lined up, good to go, and ready to be activated to immediately take down the coronavirus should it enter your body. And that's why it keeps you from getting very sick and dying, and it keeps you from spreading it, because not enough of the virus multiplies in your body to get passed on to other people.
Okay. We have a question from Valerie Spalding Parker. Dear Valerie Spalding Parker, do you think we may end up shutting back down in the winter based on what you're seeing right now?
There is a really strong possibility of that, Valerie. That's an excellent question, because these unvaccinated pockets, in some places, for example, in Princeton, New Jersey, the vaccination rate is 70%. In next door Trenton, New Jersey, is less than 35%. So if that persists going into the winter, when people are going to be all cooped back up with each other again, we're already seeing, cases taking off. I believe that in the fall and in the winter, they will take off even more.
Wow.
And that's not even accounting for other variants that might be more infectious that will pop up.
Wow. So I think a week or two before we left, we made another star out of the Mays family. And and we had Angela Stribling in, and we were talking about COVID and intimacy and what people have been doing in their love
during the pandemic.
During
right.
the pandemic. So let's go to that clip.
Here's a comment from Diana Mays McDade. I did nothing as a single female throughout 2020, but once I got vaccinated, that changed my paradigm. My prerequisite was fully vaccinated and 15 days after the last shot. I can finally kiss and get my sex on. Well, all right. So,
and there you have it.
There you have it. I think, what's her name, Diane?
Diana.
Diana, I think there are a lot of Dianas out there, and the male version as well. People want to connect. I mean, we are social beings, and we've waited a long time. I don't see anything wrong with it, as long as you're comfortable and you're grown and do you. I mean, I think again, the whole pandemic afforded us all. I'm just looking at the positive side of it as it relates to dating. It kind of allowed all of us to kind of figure out what you really want and to become that partner you want to present to your guy or your woman. What I mean is work on yourself, because you want greatness. We all do. We all feel like we're entitled to the best of the best of the best. But are you the best of the best of the best?
That was definitely the grown and sexy episode.
Lila says, Auntie is all about the safe, vaccinated, sexy time.
Absolutely. Absolutely. I mean, we have a way now to interact with each other safely. If we get vaccinated, we can hug each other. We can get our groove on. all the people who've been pent up and not doing that over the past year can now do that with other people who are vaccinated. But I'm pretty sure if you're on Tinder or whatever, which I've never been on,
Thank God.
if
You've been married.
I've been married.
Tinder's been around.
Right. Since Tinder's been around. But I would imagine if somebody is vaccinated, that probably increases their desirability in terms of people swiping on them versus somebody who's not vaccinated.
Wow. So that we love Auntie Diana, and thank you for that question. We wanted to move out of the COVID lane and really talk about some other things that we that have seemed to fall by the wayside in our health. But one of the big things we talked about was was Richard Goodjoint. I'm going to get to you in a second. But I want to get to sleep and the importance of sleep and dementia and Alzheimer's. And we had the good doctor Dr. Hutchinson?
Yes, Dr.
Right?
Barbara Hutchinson. Yeah, she's a
Right.
cardiologist and sleep specialist.
Okay, let's go to her clip.
Right. There was a study that was recently published that showed that people, especially if you have decreased sleep in your 40s, in your 50s, in your 60s, you have an increased chance of developing dementia. But that was as far as in chronic insomnia. But even in people with sleep breathing disorder, the chronic hypoxia that they have every night, when they have these apneic episodes, long term, it can cause damage to some of the brain cells that result in dementia.
Wow.
And that dementia I've seen in some of the patients with severe sleep apnea, by the way, as it's treated, it improves as they've treated for that. Yes.
That is great news. So the other thing I'd like to add is so in the book, Excuse Me, Doctor, I actually have a whole chapter on sleep and mentioned a lot of the sleep hygiene tips that Dr. Hutchinson so eloquently ran down. And one of the things that I say is the time that you sleep happens, the reason why it's recommended between 7 and 9 hours is there's different stages of sleep. And as you go into those different stages of sleep, your brain is actually opening up certain channels that allow for the cleaning of waste products that build up during the day to be released. And if they're not released, then it's like the trash not being taken out, right? And that leads to inflammation or irritation in your nervous system. And that's one of the reasons why it's thought that there's a greater association with not just Alzheimer's, but other neurologic diseases as well.
Wow.
Wow. She was such a fantastic wealth of knowledge. But, so many people came up to me and contacted me after that episode because so many people have sleep problems. I mean, it is like an epidemic, whether it's insomnia, whether it's sleep apnea, whatever the issue is, whether it's menopause and being hot at night. A lot of people have sleep issues. And I think it's really important to get that information out about sleep hygiene and also to get tested if you snore and have these, she mentioned the word apneic, which just means, you're not episodes of not breathing while you sleep, which is one of the problems with sleep apnea. And to get tested for that, because it can lead to high blood pressure, nervous system issues, strokes, heart disease, and lung damage.
Wow. So before we go any further, I told someone I had to get back with them. And Elaine Shorty says, thank you so much for sharing this valuable information. Our lives depend on whether people are willing to trust professionals or not. And then we had the incredible Richard Goodjoint said, did you see Juvenile's video? Vax that thing up.
No, but I am definitely going to go check it out.
So That was in the middle of the last comment of bringing on the thing. Also, Kay Williams says, I'm very concerned about sports crowds, i.e. NBA playoffs, tennis, baseball, inside the arena and outside the arena, screaming and shouting shoulder to shoulder like they were in Milwaukee the other night. What do you say about that, Dr. Mel?
Well,
We're in the
I
lightning
think your
round.
concern is warranted. And, if you're standing near to people and you're not socially distanced, we don't know who's vaccinated, wear a mask and avoid crowds, because the Delta variant is here, the Lambda variant is soon to follow, and we just have to continue to be cautious and be wise.
Wow. And someone said, please name the book you mentioned in the last clip, and give me 1 second. That book is right there. It's called Excuse Me, Doctor. I've got what? Renee Basley. Hopefully I'm saying that right. Excuse me if I don't. So we want you to know that Dr. Melissa Clarke wrote that book, Excuse Me, Doctor, I've Got What? And go buy it at your favorite place that you buy books. I want to move on. We got into talking about putting on the COVID-15, and we were talking about weight, and we had great guests that show, and that was Dr. Lisa Lewis and Chef Riri. But let's go to Dr. Lisa Lewis when she talks about stress and weight.
A little bit about what role stress has in weight control, and how does managing stress, how is that a component of weight control?
Yeah, so stress is huge. I mean, we know it's a factor for pretty much every disease. And again, we don't know what comes first, the chicken or the egg sometimes. Is it the stress that causes the disease, or is it all the factors and the imbalances happening in the body that then is putting stress on the system? We don't know. We don't care. Mm-hmm. We just know that we have to get to the stress. We have to treat the stress. And so I think that it was this pandemic was kind of like a perfect storm. It then created a lot of imbalance in many different organs, the lung, the digestive system, like all of these different organs that that require the support to lose weight. So when you talk about stress, you're talking about cortisol, right? You're talking about, in most cases, you're talking about the increase of the I say the hormone that's really there to save our lives, right? Because it is
the fight or flight one.
That's right. And as you know, it is why we still are on this planet as humans, right? And so when the stress is too high for too long, then the adrenal glands, they start to what I call peter out, right? They don't produce as much, and that's adrenal fatigue. But most people start off in what we call that stage 1, which is where it's excess, where the cortisol is like high. That is then going to cause the body to store fat, because cortisol has a significant effect, especially on blood sugar. Because as you just think you're running from the tiger, right? So the tiger says, the tiger's like, if I'm going to get you, so what's the body going to be? It's going to increase its blood sugar, because it needs energy to actually run. You're either going to run or you're going to stand up and fight, right? And so you need that elevated blood sugar, you need the elevated blood pressure. You need to shut the digestive system down, because it doesn't want you stopping looking for food when you're running from the tiger. It shuts the reproductive system down, because it doesn't want you looking for anything else while you're running from the tiger, right? So right? So all of these systems get shut down, and then the body just can't work effectively. And so one of those major imbalances is the digestive system, the thyroid, because cortisol actually inhibits the thyroid production. Also has a significant effect on leptin, which is another hormone that controls how much we eat, whether we're going to take that fork and so the key is understanding like how the body works, and knowing that cortisol, it does save our life, is there to support us, but in excess it can create a lot of damage, a lot of inflammation. It's the strongest anti-inflammatory known to man. So it's there to support us in inflammatory times. But if it's elevated for too long, then it causes inflammation, and inflammation is then going to contribute to diabetes, obesity, like.
It was
You
incredible.
know, she laid it down. I mean, I talk a lot about inflammation and how it is the basis of just about every chronic disease that we have. And, I had a health scare 6 months ago with diverticulitis. And one of the things that I talked to my physician about was, before you eat, take 10 deep breaths in and out, just to control your cortisol, your stress level, your anxiety levels, so that you digest your food well. And I would recommend that to everybody.
Wow. One quick thing. We joked about Richard Goodjoin, but I want to let everybody know he is a physician. So Dr. Goodjoin said, I have seen 2 patients who were vaccinated with the Pfizer vaccine who were symptomatic and tested positive for COVID-19.
Yes.
And Chef Riri, is that Chef Riri? Says, breathe before you eat. Hey, Chef Riri, how are you?
Hi, Chef Riri.
Thanks for
And
coming
hi,
in.
Dr. Goodjoin. Thank you so much for mentioning that. And those are the breakthrough infections that we mentioned. But also keep in mind that had those people not been vaccinated, their disease likely would have been much worse. I talked about the cruise ship that went out with 500 passengers, 95% of whom were vaccinated. 2 people tested positive for COVID when it came back, but those 2 people had no symptoms, and nobody else on the ship was infected. And that's because of the potency of the vaccines in preventing severe disease and death.
Yeah. Well, that was a great episode and one of our most popular episodes. Also, Black women mortality, Black maternal mortality was probably one of our great episodes, highly rated, and we have a clip from that, and I want to go to that now.
You study something called ACEs, and no, they're not the Ace of Diamonds or anything like that. It stands for Adverse Childhood Events. So can you tell us what those are and how they relate to maternal mortality?
Absolutely. So adverse childhood experiences are essentially traumatic experiences that people experience before the age of 18. So sometime in childhood and before the age of 18. And the reason why these experiences are important, there are 3 categories of experiences: household dysfunction, neglect, and abuse. And what we know now in studying these 3 different categories is how pervasive they really are in our society. About 60% of the American population will have had at least one adverse childhood experience before the age of 18, and about 1 in 6 Americans will have 4 or more adverse childhood experiences. Now, you would assume in hearing about these adverse childhood experiences that they would affect you, particularly as a child and maybe as an adult, in terms of your mental health, in terms of your predisposition for depression and anxiety, or your predisposition to try to deal with the trauma that you've experienced in perhaps some unhealthy mechanisms such as substance misuse. But what's surprising to a lot of people is that these adverse childhood experiences also affect you medically. They affect your predisposition for chronic diseases. They affect your predisposition for certain cancers. And in the case of maternal health, they increase your chances of premature delivery, of fetal complications, and of maternal death. So these are experiences that are pervasive and that have long-lasting consequences, and especially in maternal health, because these experiences are disproportionately affecting women in this country. And when you layer race and ethnicity on top of it, those same groups of people of color in this country that have disproportional outcomes when it comes to heart disease and stroke and cancer also experience a disproportionate number of ACEs in their childhood, and therefore more complications going forward.
Wow.
Yeah. I mean, that episode, people asked us to repeat it because it was just so impactful. And I think it just underscores how mental health plays such a key role in our physical health. That whole mind-body connection is real.
Yeah. Well, let's stay at that episode because we also have our favorite health champion on that episode, Dr. Yolandra Hancock, and she talks about her experience becoming a doula.
Dr. Hancock, you're a pediatrician, but as a mother of a beautiful daughter, you have a story to tell about what happened to you around the time of her birth. So tell us that story and how it's affected your decisions professionally going forward.
Sure. So in my last trimester, about 2 weeks before my daughter was actually due, she stopped moving. And I was, throughout the pregnancy as a Black woman, I was continuously concerned about how I would survive through having a baby. It took a lot of effort to get pregnant. And as I delivered her, one of the happiest moments of my life, the day after that, I had a hypertensive crisis. I literally felt like I was going to die. And that's what I communicated to my nurse. My blood pressure was 200 over 110. And I ended up on blood pressure medication for almost 6 months after having my daughter. I had never had a blood pressure higher than like 115 my entire life. And, throughout the pregnancy, it was so difficult, a lot of stress. I dealt with micro and macro aggressions as a Black woman working in a predominantly white institution, overworked and underpaid, and I was having relationship issues, and I didn't reveal it to anyone. I felt as a Black woman, I would just sort of meditate and pray my way through it. And I wish that I'd had a doula, but being a pediatrician working out in the inner city and with loans to pay, I didn't have the money for a doula. And unfortunately, insurance didn't cover it. And because of that, and then the continuous loss of Black women across the country, it really pushed me. I've always been interested in natural ways of healing, learned a lot from doulas and midwives when I was in medical school, and made a commitment in 2020 after we lost one of our sisters in pediatrics. A pediatric resident lost her life soon after having a baby just last year. And it's what compelled me. And then finally a mother asked, she said, if I have a second baby, the only way I'll do it is if you serve as my doula. And when she asked that was what sealed the deal to facilitate me becoming a doula.
Wow.
Doulas are like health coaches, and a lot of people don't realize the high level of Black maternal mortality that we have, and doulas are really seeming to be a help in being able to help women navigate the healthcare system and have better pregnancies and better health outcomes.
Wow, I don't know where the time has gone. Actually, you win the bet today. You bet that we wouldn't get through all the clips, and we are right up against it. And as a producer, we can't get through all the clips. So people have to go back through the episodes and check it out. So,
well, the one episode we didn't get to was Black men's mental health. And, I would encourage everybody to go back and watch that one. The clip we were going to show, which we don't have enough time for, was about how to choose a therapist. And I think, one of the themes that have run through all these clips, like I said, has to do with knowing yourself, knowing your levels of stress and anxiety you're under, stopping, breathing, understanding that, because these things play such a great role, not just in our mental health, but our physical health. And it's really important to make sure that we are in tune with ourselves to be able to know when to get help, because it can have long-lasting consequences if we try to tough it out, just like Dr. Yolandra Hancock was saying, try to tough it out and power through without getting the help that we need.
Well, Dr. Mill, this is you. We are here.
Right. Well, I just want to thank everybody for tuning in. We hit so many topics tonight. Thanks everybody for all your wonderful questions, and stay tuned, because next week we are going to be back with some extra special guests. As I said, we're going to be talking about health issues within the LGBTQ community, barriers to care that community experiences, especially in light of that outrageous bill that was passed in Ohio that we talked about in the weekly recap. So stay tuned, bring your questions, tune in to Russ Parr's morning show tomorrow morning, where I'm on every Tuesday at 8:50 a.m. Eastern Time. If I don't see you before next week, remember, be wise, be well, and be health empowered.